we also talked about volume issues. So we have left to talk about the structural things that happen, and the underlying process behind all of it is mainly atherosclerosis. So that's why I talked about the pathology of CAD kind of up there. So we're going to talk about each one of those. The other thing you guys can think about, and let me know after the break kind of thing, is that we'll be finished covering content today as far as your exam goes. So this couple of things we can do. We can continue on because sepsis, GI stuff, hemorrhagic stuff is what's on your next exam. If I do that, start that part today, that's not going to be on exam 2, but if we do that today, then you can have a study day on Monday for your test on Tuesday. Otherwise, I have to cover other content. I know y'all hate hearing stuff right before you have to do a test. So we can do some of those things today, and then you can do your test on Tuesday. Y'all got to vote on doing that. Your quiz is actually going to be on sepsis itself, so I'm going to give you some stuff to look at. I think we already talked about going to the CDC website, but looking at what you do for a patient that you suspect has sepsis and that kind of stuff. So that's where that's going to go for that particular quiz. Tomorrow, we're going to be on, I still didn't finish working the schedule. I had students in my office all night. So I didn't leave at school till 10:30 last night, so I'm like sitting. But we're going to be at the hospital tomorrow. Sandra has a meeting tomorrow, so she's going to meet you in the cafeteria tomorrow at 3:30. So you guys are going to meet us there about 3:15 or so that you morning people can give afternoon people report on the patients that you have tomorrow. And then I'll figure it out, Will. Before this weekend's over, I'll have the schedule for the rest of the time that we're going there.
So evening people, 3:15.
Yeah. Now for your the other thing is we did get a formal response from the school yesterday about what the schedule is going to be like for classes. They did get rid of all college days. So we have that Tuesday for class. Now the thing about it is it affects you guys less because we were already on schedule except for 2 days. And you guys are faster than my other class. You visited, so you see they're a little bit behind because truly that whole piece, and I know sometimes people get out of shape about things, but if you don't build a foundation in the first class, it's a long time for them catching up for things that are going on. So with some stuff, it's okay that you kind of, you glaze over it, but as a whole, that group it's like sometimes teaching NP2 and NP4 together, because that's how it, and they'll tell you that. You know, I'll say this is something you should have seen in NP2, and they always give me a look like, so I'm like, okay. So sometimes that happens, and some of it's perception, some of it is, I mean, when in the scores in the class, you see it. So it's not always just that it's out there kind of thing. So for you guys, I don't think there's going to be any disruption in your schedule because we always end up staying ahead. And y'all know you can ask me questions if you need to ask questions about stuff. My other class is a little different. So they're actually going to have to schedule something outside their normal time. So more than likely, our stuff will be off a day. You like moving stuff over another day. But I doubt it if we have to have another day. The way it looks right now, we should be able to get it done. If it's for any reason that there's something that happens and we do have to do something, it'll, like I said, it'll be towards the end of the semester, so we'll still have time enough to plan it if that's something that we have to do. But right now, I don't foresee that actually happening with us. But there were some changes that they're going to make to the schedule that accommodates everybody other than us. So I'm going to go fight about that today because I don't think it's just fair that, yeah, I'm the only class that's like this, but don't make my other classes suffer for y'all. I'm just saying. Because they want to move back and have clinical all, because school is now going to be open till the 16th of December. That's going to be the last day of classes. So what they are talking about doing is actually, we still do Leadership Day on the 1st of November because that's scheduled for everybody, but they want to be able to have class on the second and third, which means that people would have to start leadership Monday the 5th. So that's 4 days people could have done leadership before they could actually start. And so it doesn't impact them, it helps them, but you guys would already be done if we can stay on schedule like we are. So I gotta go talk about that today. So we'll see what happens with that. So just keep your eyes open for what ends up happening with that. And we'll, like I said, we'll let you know, because I know we'll ask a question yesterday, especially because I know y'all have to look at your schedules and how you're doing that. Because right now you probably already told your people this is the period of time that I may have to be off. So that's what makes me crazy. So we'll see what happens with that. That review course is staying the same, so the days on that aren't going to change. It's just the days around the clinical that may change. And it's good and bad in a certain way, because it's good that you don't have to freak out about getting your hours in. We got a few more days we can add to the schedule. But it is bad when you give it out to people and you probably already have told people that you're changing your schedule to accommodate it. So that's the issue we have. So I'm going to talk to them today about that, because there will be something official that will be posted on every NP4 site. So what's going to be posted is all the same. So it won't be that one class does something different as far as that part of the class goes. As far as content goes, I was the only person that didn't lose 4 days. So that's what that whole issue is. And I understand that, but kind of thing. I go with the flow for some stuff, but other things I'm like, whatever. Leave my people alone, kind of thing. So we'll see what happens with that. And the only thing that's going to change for you guys, because I think on your schedule, as far as clinical goes, I think the 18th was the last day before. That part is going to change, because you're going to go till the 25th. That's the only thing that's different for your class. So, and that I understand about the days kind of thing. So, we'll see what happens with these crazy folks. Hope I don't have to go crazy on people. I'm trying not to anymore.
October 25th?
Yeah, because I think the 18th was originally the last day listed on your class.
So we're not doing the 7 to 7 things?
Huh?
The email that was like, I think we're gonna go 7 to 7 on 2 days?
Well, it's the issue that we have is that whole stupid class that's in there when we are. I knew I shouldn't say that because I'm on camera.
Oh.
They're messing up my life. That's what it is. Because if they weren't there, it would just be fantastic. I could put y'all all over the place and not have a problem. But that's what the issue is. I'm going to try to keep it to the same, because that's my thing. If everybody else can't catch up, I'm sorry. You just have to be. But we shall see. I will let you know, though, for sure. Because that's the stuff we're trying to work out. That's the negotiation piece that I'm trying to get with my folks. So you can't just dictate because your classes are different. Because they actually switch campus, because normally our campuses do clinical on different days. And then they ended up doing class on the same day. And I'm like, what did you do that for? Because now you have a clinical space that should be on Friday where nobody is. And I will tell you what ends up happening is some school's going to come and take over where you were for clinical. And I said, what are y'all thinking when you do stuff like that? I think they smoke crackers somehow. It's craziness that these people do. But I don't know.
I have a question. So if the semester ends till December 16th, my question is, will we be doing anything coming here for classes or anything December 14th to the 16th?
No, you get that. It'll be leadership stuff. That's the only thing. Because everything that's on that schedule as far as your what do you call it? The mandatory review course, penning, all of that stays the same. What they did was because those classes who miss 4 days really need class time, is that what they're doing is pushing the leadership days back. So the leadership can go until the 16th of December. Because right now the leadership ends on the 4th or 5th, whatever it is.
You're talking about the 72 hours that we have to keep
Right.
preceptorship, but
Yeah.
but we can get it done because I have a class starting on the 14th and it's from 12 to 4.
Right. That's what I'm saying. It's not necessary. If you're not, it doesn't affect you, then it doesn't affect you. But that's the thing that they're looking at, is that they're extending the year until the end. But they're going to make us pay back that stupid all college day. But that doesn't affect y'all. It just affects us. Then I'm going to kill myself. But could you just give me the day off? Kind of thing. Yeah.
So December 12th is still
Yeah, pending's still gonna stay the same, yeah. Because I know people have already invited people and all that kind of stuff. That part is gonna stay the same.
Okay.
It's just that, normally what they would do is, because that's officially the last day, was the official last day of class. So in your context of what you're thinking about when you make your application for the Board of Nursing, usually what happens on that last day of class, you can count a week, and that would be when your stuff is sent to the Board of Nursing. Because we look at stuff on our side, it goes to the registrar, then it comes back to us, and it's sent to the Board of Nursing for you to take your test. So that's why I always tell students, think about the last day of class, and give it a week, and then your stuff is there. So then you can think about when you're gonna get your state pass. So once that week is up, then you say, oh, in another 2 weeks, 2 to 3 weeks, I'm gonna get it. Now, because you're doing it in the fall, you'll get them faster. In May, all the schools graduate, so they come slower. So you'll get them a lot faster. That's why I had people who were taking their exam on Christmas Eve. Yeah. I had a student who actually did his test on Christmas Eve,
Yeah,
and we graduated on the 6th. So it can be that quick for you. And as everything tells you, do it within the first, do everything before 6 weeks. So don't sit and wait. We have some people that go on vacation, all this kind of, no, get it done. And then go out of town and do whatever it is you're going to do. Makes it a lot better, kind of thing. And you can really party like a fool while you're out of town doing things where nobody knows you, right? And you know how y'all are. You have to be calm when you're in the city where you live, but out of town you do that. Oh. Especially in Vegas, right?
don't let nobody know you're a nurse.
Exactly.
I seen on the news where they fired this teacher because she was twerking, like, it's some type of contest, and she was a teacher, and they fired her.
But she's working.
Dang.
You can't work now?
With a tea bag on, she had on a tea bag.
Oh, my
It was
goodness.
all on the news and everything.
Don't let people
You
video
can't
you.
twerk with a tea bag on. In another country, you can't do it.
My goodness.
G-string.
Oh,
Putting it all
I never
in
heard
out.
it called the telephone like song.
That's about
Oh,
Oh,
yeah,
yeah,
for a tea
thumb,
bag.
yeah.
Oh, okay, sorry.
That's wrong on so many
So
levels,
old.
I'm saying. I'm telling you, the internet is the devil. That's all. People just do stuff and they just, you don't think it's going anywhere, but stuff can
There
follow
it
you.
goes by.
Especially because if people don't like you, they can just say, it.
I think,
They just send it out there. All right, so
Miss H, before you start, I have a quick question about the calendar. Okay, so November 1st, it says leadership orientation. That's all of us
that's every MP4 class.
and at Del Mabry for the whole day.
Uh-huh.
Okay, and then the next day is Group A. That's the
That's the part that may change.
That's the preceptorship part.
Right,
So that part might change.
right.
Okay.
Those days that you have to come in won't change because that's already
So
set.
we're all gonna come November 1st.
We're all gonna
what?
come November 1st, and then if you have Group A, there's a day that you come in for something.
And
And Group
the
B has
senior
to come in
seminar.
for- Right, the senior seminars. Those days won't change
Okay.
because they already know people have set up their life for those days. So that part won't change.
Gotcha. Okay. So what will change is the preceptorship period.
Right.
It might
Maybe.
get what, pushed back, pushed forward.
It might be, it's gonna, if it stays like it is what they wanna propose, it will be pushed back because you wouldn't start till the 1st. I mean, not the 1st. What's the Monday, the 5th?
The 6th, I think.
It's either
November
the 5th.
6th.
There would be the 5th or the 6th they wanna start
Okay.
leadership.
Gotcha.
And that's so they can actually pick up those 2 days for class. See what I mean? Because we do the leadership orientation on Wednesday.
Because it starts on a Thursday. Group A starts on a Thursday, the 2nd. So you would
See
say.
that, but that's what I'm saying. You're penalizing my classes. We only miss 2 days. You know I can catch up a day quick. So that's what hey. So I'm fighting for my group.
Just let them know that we're LPNs and we work and we need to know this ASAP.
So that was my thing. I was like, because they were trying to talk about doing because you guys this group is the only class that's already taken their first HESI exam. So they're making all of them do it on a Saturday.
The one we took, the practice
practice
one? Nobody has taken that?
Only y'all.
Dang.
I know because it's like my thing for my evening group was trying to make sure I have a room, and I had a room, and then the school was closed last week. So I was gonna do that one, but they haven't done anything.
I think.
That's right, they have not taken an exam at all. Their first exam is Thursday. So everybody else is behind,
You're talking about the other classes?
the other classes.
So us in your evening are good.
Yeah.
Wow.
Oh, the evening class already took exam one?
Uh-huh.
Oh.
They took exam one,
Oh,
quiz one, quiz two, everybody got credit for. So they're,
Thank you,
but they
Irma.
have not done,
What happened, the HESI?
they haven't done the HESI or exam one.
The other NP course too.
The students were in school,
Classes taken respiratory test.
No, the evening class is the same
No, her
place
class
you
is
are.
good. The other NP course.
Oh, I see, not.
with the other
It's
professors.
like 124 of us.
Yeah,
Gotcha.
the 40 that I have done their exam one, quiz one,
Okay.
HESI. And you guys have done the HESI. Everybody else has not done the HESI. So that's South Shore, both Del Mabry classes, and my evening class.
Wow.
So it's madness. And my HESI would have been done for my evening class had school been open last week. So we're the farthest ahead as far as that part goes.
And their preceptorship starts at the same time as us.
Right, because
So what are they gonna
everybody
take? They're
does,
gonna take like exam after exam?
everybody does the same exact schedule. That's the thing.
Oh, wow.
So that's what the problem is that now they have to catch up a lot.
Yeah.
So, I don't know.
That's not teacher's problem. I mean, good for you.
Y'all are so kind, you know?
And there's like,
Nothing you can do.
It's like, deuces, I'm not doing it.
40 of us at Penny.
Y'all are so bad. But anyway, that's what we have to talk about, because they'll be on campus when I get there today, so I can talk to them about what's going on. All right. But otherwise, like I said, I'll let you know. Probably I'll let you know tomorrow, because we'll all be together for clinical tomorrow. All right. So this is the structural stuff we have to talk about. So we have coronary artery disease. And the reason that's kind of separate is because you have to, that whole issue of coronary artery disease, atherosclerosis, is the underlying pathology for most stuff that has to do with cardiac. Even though we talked about electrical stuff yesterday and we talked about volume issues, a lot of the things you see that go wrong with patients have to do with the underlying process of atherosclerosis. So then we have unstable angina. In NP2 we talked about stable angina. We did talk about the difference of it, but we're going to focus a little bit more on it in this particular class as it relates to now the patient is going, there's some change going on with that plaque that is there. The stabilization piece is gone, and you see some differences that happen with their angina. Then we have acute coronary syndrome. And actually, if you go on your the class site, there's a nice little video there about ACS that kind of talks about what it is. There's little stick people that talk about, some little cartoon people. They do a good job on that. We also have acute MI, because that's the worst case scenario when we talk about, well, I have not exactly the worst case, but there's one even worse that has to be up there, and that's cardiogenic shock. But those are patients who actually end up, now we have death of tissue when we talk about patient having an MI. So I'm going to put cardiogenic shock over here. Because that's truly the worst of the worst. Then we have our inflammatory stuff. We have endocarditis, pericarditis. So you're talking about where the heart has the infection, because this is what that's talking about. But when you talk about pericarditis, it usually is inflammation as opposed to a true infection. You can have it, infection-based, but most of the time it's an inflammatory response. Then we have mitral valve disease. Not that the other valves don't matter, but the ones that's diseased the most is the mitral. So that's the patient that usually presents with problems. The other valves do happen, and in the order of succession, it's mitral valve first, aortic second, when you talk about disease and pathology that's happened there. Pulmonic, tricuspid is last. There's hardly ever anything that happens with the tricuspid valve. It does happen, but it's rare. Then you have aneurysms. This is the outpouching that happens in the vascular system. There's also a video for that on your class site that talks about aneurysm. And then we have acute arterial occlusion, which is the last part of our cardiovascular stuff. Now, the thing about it is, yesterday we talked about, you saw how the meds are used for every single thing. You're going to see a lot of the same meds that we use here for management of these patients, things that you do for them, that type of thing. Up here I talked about the pathology of CAD. Basically what you see is atherosclerotic plaque attaches itself in the intima of the vessel, and that's something that you see early on. So it starts happening because of our diet. So we eat a lot of fat. That's one of the things that you see that goes with that. When you autopsy teenagers, you already see fatty streaks at about 16, 17 years old. So you have the process already happening there. Okay? So as you eat and go along in your life and do things, have hypertension, sedentary lifestyle, but mostly eating bad, produces that you get cholesterol that goes there, creates a matrix there, and just just globs together, and it continues over time. So what ends up happening is you're going to have a plaque that decreases the lumen of the vessel. Because the plaque is there, it's going to decrease the amount of blood that can flow past it. And when you have a mismatch between oxygen demand and supplied blood, that's what produces pain. So that ischemia that happens with the patient is what's causing the pain. So it's decreased perfusion caused by the atherosclerotic plaque. Now, of course, as we get older, plaque is going to form just because we're getting older, but there are some things that increase the progression of disease. And that could be people that have lipid disorders, if you have hypertension, those types of things, because they accelerate the process. So if you have a person who is young and healthy, like you guys are, who actually has risk factors for cardiovascular disease, and you have a high blood pressure associated with it, makes your coronary arteries like somebody who's 70 years old. Okay, so even if those kind of things you have to look at as far as making sure you can manage your patients. So that's the kind of issue that you're looking for with them. But it is something that happens over time. So what you want to do is kind of look at those things you can change as far as risk factors. You cannot change age, you cannot change gender, ethnicity, those kind of things, but you change all those things that you can. Keeping your blood pressure under control, losing weight, controlling your diabetes. Those will be all things that you want to try to make sure this patient manages so that they can actually decrease their potential for having a problem. The other thing we do, which is also part of screening now, is that yes, we do annual cholesterol levels on patients so I can see what your total cholesterol is. I'm also going to look at your HDL, because a low HDL, which is the happy one, the good one, that's how you remember those. H is happy. A low HDL level also contributes to patients having coronary events. The other thing that we look at is CRP, okay, that C-reactive protein. When that is positive, we see patients that have some type of cardiovascular event early in life. So doctors test you now as part of routine screening that you get done for patients to see whether or not this person is going to be at risk for developing some type of cardiovascular event. So it is something that we see that is part of our routine screening now. So yes, you're going to do your CBC, you're going to do a urinalysis every year, but you're going to see people do a CRP. That's an inflammatory measure, because that's what it is. C-reactive protein measures a degree of inflammation in the body. But the thing about it is we see it's positive for patients who have a high incidence of coronary artery events. So that's a person that I want to do modification of risk factors, maybe put you on an aspirin therapy unless it's contraindicated for you. Because you can do low-dose aspirin. 81 milligrams gives you the same effect as 325. Okay, but this is something that's going to help as far as decreasing a person having a problem with coronary events. So that's what you end up seeing for your patient. So we do that as far as our screening goes. We also look at the LDLs. Remember, low-down dirty lipoprotein. That's the bad one. Has a high affinity for coronaries. So when LDL is high, you're going to see a person that's more at risk for developing coronary events. And what we want to do with those patients is decrease LDLs. Now the best way to do that is exercise. Changing your diet, but how does that work for the most part? It doesn't really, for most people. So even though we give a patient, you may see that a doctor will give a patient a period of time where they're not giving them medications, more than likely you're going to see people on a drug. Okay? And so they go on one of the statin drugs, because statins help to increase HDL. They also lower LDLs. So that's why you use those. If you got a person that does not want to take a true medication, you may see a person take vitamin E. or fish oil supplements, because they do the same. But, you know, people have to tolerate, you know, you can't have allergy to fish, true allergies to fish, you can't really do fish oil, so people can't do that. But there, you know, that's something that they can actually take for that. But some people like that as opposed to taking statins, because statins have an issue with liver. So if I got a person that likes to imbibe quite a bit, you know, can't really do that because that's something I got to worry about your liver over time. Okay. So the statin drugs work great. Your body produces cholesterol in the evening. So patients who take cholesterol drugs should take them in the evening. You will see patients get a better response as far as their therapy goes when they're taking their meds at the right time. Because you know how people go, well, I keep taking this drug and my cholesterol never goes down. Ask them when they're taking their drug, because that could be a part of what's going on with them. Okay. So they should actually take it in the evening, because that's when your body produces cholesterol. What do you have to monitor for when patients take statin drugs? We got to know we got liver function tests in there, because it big time affects your liver, can cause you to go into liver failure. Huh?
So, I know that.
Yeah, they're big time for that. What can't they eat or drink? Just another one.
Grapefruit juice.
Grapefruit or grapefruit juice can make a patient toxic on the drug, kills off your liver. So that's the issue that you have with statin drugs. The other thing you check them for, the doctor may check the patient for, is they do a test, what we call CPK. Now you hear about that before, because we talk about it in relationship to cardiac muscle when we're going to talk about acute MI. But one of the things CPK does is creatinine kinase. It tells you about muscle destruction. Okay. So when you have a patient who has a positive CPK, the other thing and why it's so important, we talk about statin drugs, and this is one of those things when you're listening to the commercial on TV. That's the thing the guy's saying real fast so you don't hear it.
Yeah.
All right, he's talking about report muscle pain or weakness. Everybody misses that, right? They're talking about it, but they say it. I'm telling you, listen to the commercial about Crestor and all that kind of stuff. Muscle pain and weakness is one of those things you see with rhabdo. Rhabdomyolysis, the worst case scenario when you're taking a statin drug. What rhabdo is this actually causes the muscle pain and weakness is from inflammation. So if patients tell you, oh my gosh, you know, my leg feels so sore, it really hurts, it's tender, that's something that needs to be reported right away. Because rhabdomyolysis is tearing down your muscle, but one of the things when you tear down muscle, it creates a large molecule that cannot filter through the kidney. So not only is it going to kill off your liver, it's going to cause renal failure. So rhabdomyolysis is the worst case scenario when you're talking about taking a statin drug. That's one of the reasons why you do liver function tests before you start the medication periodically throughout. Because you want to see when you start seeing liver function change, because patients who have problems, we don't keep them on statin drugs. And you don't give it to them again. You go to one of the other drugs. Mainly because you can end up causing permanent damage to a patient. Because everything you take in life is going to be metabolized by the liver, excreted through the kidneys. So if I kill off your liver now, every drug you ever take, I got to worry about how I'm going to dose it for you, if anything ever happens to you. So those are things that you kind of make sure you find out sooner than later. And that's one of the things you tell the patient when you're, that's one of the important things to do as far as patient teaching with statin drugs. Yeah.
So would they have that same muscle pain and weakness with like the vitamin D?